Since September last year, at least 23 aged care homes have shut their doors as the sector struggles with Labor's stringent reforms, including 24/7 mandatory registered nurses and minimum care requirements. Joining me now is Shadow Health Minister and Aged Care Minister Anne Ruston. Anne, thank you so much for your time. The requirement for aged care homes to have a registered nurse on 24/7 is one of the major challenges for aged care homes. What's the shortfall between the number of nurses and care staff needed and the reality on the ground?
Well, we know that there are approximately 20,000 registered nurses required in Australia at the moment. And clearly the requirement that this government is forcing on aged care facilities to have 24/7 nurses on call, on site at all times, in the wake of this extraordinary workforce shortage. It's just ill-considered, and as you rightly pointed out in your introduction, 23 homes have closed since September last year as a direct result of this government's refusal to accept the fact that workforce challenges, despite best endeavours, are preventing nursing homes being able to get the staff that this government is mandating that they have.
Yeah, it's classic Labor though, isn't it? They are really good at the announcement, able to articulate something that sounds good in the moment, but in the practicalities, what this is doing is actually taking aged care places away from a community that needs them. Providers have been sounding the alarm for quite a while on this plan, and yet the government's response has been to bring the date for compliance forward. The government says it'll fund a 15% wage increase to try and help manage that, but is it enough and is it sustainable?
Well, I think you hit the nail on the head. This government is a government that's all announcement and doesn't actually think about the logic and the logistics of delivery of their particular requirements. I mean, of course we want to see older Australians get the care they need. Of course we want to see nurses on site 24/7. But in the midst of workforce shortages, when we can't do it, well, there is a problem. Equally, of course we want to see our aged care workers paid an appropriate amount. They worked so hard, they looked after our older Australians during the pandemic. But we don't know how this 15% is actually going to be passed through. Is it going to be 15% on a base rate? Is it 15% on what people are currently earning? I mean, there are just so many details that this government just fails to even consider before they go out with their big headline announcement and leave all the chaos in the wake and the uncertainty and the distress that it causes in the sector because they don't know the details. Aged care facilities do not know what's going to happen to them on the 1st of July if they are unable to be able to meet the requirements, those that have remained open. What happens then? We're only 5 weeks away and the sector still doesn't know what's going to happen.
It's causing great anxiety for the families that depend on these services being viable. Moving on to Labor's infamous broken election promises. Let me jog your memory for a second. Last year, the Albanese government promised this.
Why a Labor government will invest in urgent care clinics across the country, taking pressure off emergency departments and making it easier to see a doctor.
He went on to promise 50 after-hours clinics would be up and running, quote, within a year. And it's 1 year on, and not a single new urgent care clinic is up and running. What on earth is going on?
Well, that is a question that I think every Australian should be asking Mr Butler and Mr Albanese. They said that it was never been harder or more expensive to see a doctor than when they came into government. Well, I can assure you it's harder and more expensive to see a doctor today after 12 months of a Labor Party government. We have no urgent care clinics, and we now find out that actually in most instances all they're intending to do is to rebadge existing clinics. So no new facilities, no new doctors, just a bit of rebadging, and then apparently Australian public have got to accept the fact that these are urgent care clinics. It is a great big con, but another classic example. Great headline announcement, but no delivery.
Con and spin, but the cupboard is bare. There's so many more examples about the ways Australians have suffered at the hands of the government's inability and failure to invest in the health system. And one of those is happening in Queensland at the moment, where a major hospital has resorted to leasing hotel rooms off SeaWorld to care for their patients amidst a chronic hospital bed shortage. Take a look at this. this is disturbing, but probably the most disturbing part of all of this is the way that Labor MPs and ministers laughed and carried on about it while this dire health crisis persists. Very quickly, what's your take?
Well, I mean, it is just a ludicrous situation in 2023 to consider that a state government is in such disarray that it's actually having to put its hospital patients into SeaWorld hotel beds. I mean, it is just beggars belief that we could have seen a government mismanage their healthcare system to such an extent. But the really sad thing, Amanda, is I don't think that the situation we're seeing in Queensland is a lot different in many other states and territories around Australia. We've got a chronic crisis in our healthcare system and government's just not doing anything about it.
Yeah, this Queensland government's been in for 10 years. Time is up to get this sorted. Anne Ruston, thank you very much for your time this evening.